listeners now, we'll go into our final segment of the webcast today. We're going to be hearing from UW-Extension. So many of you are educators from UW-Extension. I think this section will also be relevant for you community partners that are interested in kind of tuning in to get a better understanding of what people are seeing in the field, what their perspectives are, what resources are available out there. So I'm going to go ahead and turn it over to Mary and Roberta, and we will close after they are done. Thanks.
Thank you, Danielle. Mary, you chose to be part of our Healthy Living Teams work group called the Health Insurance Literacy Group. What made you consider helping CKF and Extension as a whole to try to develop programming around this?
Well, Roberta, I see this as an opportune time for UW-Extension. You know, they can be the pivotal force and have the role out there in terms of sharing information and providing quality educational programs at what I call the teachable moment in 2013. It's a time when people have lots of questions about the Affordable Care Act. People don't understand what's involved and what it means. And as a result, a lot of people who don't have insurance are going to need to make choices. But it also has opened the door for those who currently may have insurance to take a look at those exchanges and say, oh, is this going to make a difference for me? And they need to make informed decisions as well. It's a time when, if you look back at the last election, costs and benefits of the Affordable Care Act were of major concern. Those concerns haven't necessarily gone away at this point in time. Community stakeholders are still questioning what's this going to mean in terms of our community, the businesses that are here, and what's it going to do to the face of health care and the workforce that we have out there. And so Extension in Wisconsin can, as well as Extension across the nation, has the opportunity here to be the force in that educational component to alleviate the concerns, help people to make informed decisions, and thinking back on what Jenny said earlier today, to be that navigator that's needed to help the many people that need to make the informed choices about health care insurance and what that's going to mean in their lives.
Before I ask the next question, I just want to make sure, because some of the folks listening may not understand that Cooperative Extension has a county-based system, so that when I speak with Mary, she is representing her La Crosse County Extension office, and we have representatives of faculty in every county of the state. So when we think about the kind of resource that might be available to either do the work as the lead or as a partner, and in fact probably always partnering in the community to get word out in terms of public issues education. Another question for you. What are you hearing in your community? Are people talking about the Affordable Care Act? Do they understand any of this?
Well, I would just say, Roberta, there's lots of talk and probably more questions than anything. Just in the last week, since we've had the election, I've had the opportunity to interact with legislators and local officials, elected officials as well, who have many, many questions. They have plenty of comments as well, but questions that are directly related to what does it mean or what is it going to mean. I've met with a couple of different local coalitions, and they too are wondering, well, what will happen? What's going to happen to our numbers? How will we serve them in the La Crosse area? Already thinking about what can we do to provide additional access points for people who need to sign up for an exchange or need more information about it. What can we as a coalition do to share that information? And then within my own office and across the state, I've received several calls from people representing the agricultural entities and farm families, farm businesses, and what's it going to mean for their business? What will it mean for their employees in their business? And then ultimately, what will it mean for their own farm family? Some have employees, some don't. So the concern is based on where it's coming from. But it's great because when I've had those questions. I've been able to go to the website that Extension and the Covering Kids and Families Partnership has set up, and anytime I've had a question, there's either been a response there, or if we pose the question, you've been able to get the answer on that website. And so it's great that we have that available to us. But in thinking about that, that's one resource that you've been able to provide for us at the local level to use to be able to respond to questions that we received. What else is the health literacy team that you're working with in Extension, along with CKF? What else do they have planned in this next year, Roberta?
Okay, good question there, Mary. We actually have a lot planned. What we're trying to do is think that we are in a position to be able to do a lot of general preparatory education of people and communities, to prepare them so that they're ready to be educators at the community level. So we're doing a series of webinars. I started doing webinars back in 2010 when the law first passed. We have a website now. It's called our CKF's ACA website. We expect to put together train-the-trainer programs, volunteer kind of train-the-trainer programs. We'll be doing presentations that people can take out in the community so we don't have to do it, but giving to you a 5-minute, a 10-minute, a 20-minute presentation that can be taken out into the community so you could talk to consumers, you could talk to businesses or providers, and we'll have those of varying lengths. We're putting together a series of fact sheets. I have one to show you in a second. We are thinking about social media plans. We have a Facebook presence. Twitter is really being pushed on us. I need some real convincing about how it can be used in this way, but we'll be open to that. And then there could be partnering with all sorts of colleagues of ours, including our colleagues on our financial literacy teams. Know that there's a national movement that Extension nationally has grabbed onto. It's a health insurance literacy movement, and it's defined here as the degree to which individuals have knowledge, ability, and confidence to find and evaluate information about health plans, select the best plan for their own or their family's financial and health circumstances, and use the plan once enrolled. This is being spearheaded right now out of our colleagues in the University of Maryland. You can see that they have a place for our state's logo right there on helping consumers make sense of ACA provisions and health insurance plans. So we should be able to partner with what's going on a national level with this health insurance literacy piece, which will be kind of the end product. All right, now the exchanges are in place. How is it that we help consumers figure this out? And in fact, Mary, this is a navigator role, and I imagine we will be in conversations with CMS as to whether or not CKF and or county extension faculty can help play this role in the community. So, another question for you. Given the breadth and scope of all the kinds of things that we've laid out here, the concern with enrolling families, but also the preventive aspects of what's happening, what kind of programming does this mean for you in the community? What are the kinds of things you could share?
Well, first off, I have lots of ideas on the kinds of things that can be done and the ways things can be shared. But thinking in terms of my counterparts in other counties, they first need to take a look at what's the need in their local area. How does it fit in their programming? Is this going to be a priority for them? And then can they fit this educational component of helping people learn what's needed, how to make an informed choice? If that's something that when they choose to do that, if it's in the best interest of the programs that they're doing, the families that they're going to be serving, and this surface to the top. And if so, then I've divided it into what I call traditional programs and somewhat more newer traditional programs. Special interest or general type one-stop sessions where Extension is the formal presenter, or they co-present with other agencies or organizations, entities out there. And in this case, for the Affordable Care Act, that might be AARP. It also could be taking a look at county health educators if they have them in their communities. The local ADRC, the Aging Disability Resource Center, aging benefit specialists, maybe even co-presenting with people from their medical institutions or even the local pharmacy. but doing that one-shop stop where people come in, get general information. You mentioned the train-the-trainer concept and packages for that using volunteers, and I guess I would say retired educators, retired business people could play a key role in this out there and greatly extend Extension's efforts, whether you train them and then they take the information out or they work directly with individuals. The other entity would be plan an insurance fair, and that would be where either the Extension educator or someone else that they're co-working with, collaborating with on this effort could do presentations, but then the local vendors could be there and people could interact with them, but then also have the specialist available to be able to respond to their questions so that they get what I call the unbiased response. Mini lab experiences, whether that would be through your local technical college, someplace where you have computers available. Could be your high schools, even the middle schools, that you'd have a bank of computers available that people could work from. Maybe even it's your county boardroom where your supervisors may have computers available to you, but the navigators there can be available to help people work through that process if need be. There can be an educational component as well as hands-on, I call it experiential type learning. Work with your local media, whether it be TV, radio, newspapers, and do a series type of education, information programs or articles that people who can't or prefer not to come to formal meetings but prefer to read information can use that source to learn about the program. And then, of course, we can talk about fact sheets, and I know that you've been working on that as well with the CKF project. That, along with video trainings, are possibilities, and then share those through employers for their employees, work with chambers of commerce to make that happen, business groups that are out there, and then use that same type of material or information with what I call the newer traditional programs, using that web page to put that video on, the fact sheets available, using Facebook as a source, including it in local blogs if you have a following for that. And you mentioned Twitter earlier also, and I still have a problem with trying to figure out how can you get good content about the Affordable Care Act in 140 characters. But that's a significant number of our population that use that, and so we need to find the answer to that question. And then finally, build on coalitions and collaborations that we currently, Extension is known for working with in their communities. We're the organization that brings people together to build capacity. And so take the lead in planning and presenting educational information with or through that coalition. And the Extension educator can be the formal presenter that has the background, or if you have others in your community that are more knowledgeable in this, it's that co-effort that will help us to extend further.
A few things there, Mary. You're reminding me that some of this is convincing county board members of why Extension really has a role to play here, and that I've mentioned a few times that there's money on the table. One of the ways in which there's money on the table is also as extenders, and the extenders are those people that, it's funny that they took the word from Extension, but the extenders are going to be community health educators that are going to be able to be paid through a managed care organization, say for a wellness program. So a lot of the work that Extension is already doing in the communities, nutrition education, some lifestyle education, may actually be reimbursable. Those things need to be worked out, and I'm looking at that at the state level. But that's another opportunity to both understand that this is kind of the next phase, and Extension to be a partner, there might be money involved. All right, another question for you. I know that we've been asked, both of us, by county colleagues, why should I really spend time programming here? Can you answer that and also address what considerations Extension educators should weigh in on as they think about educational programming in this area?
Well, a couple of thoughts, and I would just say, first and foremost, Extension faculty and staff in their communities are known for having the pulse on their community and what's needed, and they're also recognized as providing unbiased education about things that people need to know about. And in this case, it's going to be the Affordable Care Act and exchanges that are out there. And so this area, this Affordable Care Act, though, has pre-election, was a highly politically charged topic for discussion, as well as it was one that I guess even now still maintains some of that in our communities. There are still going to be people out there that don't think that this is the route that we should have gone or that we should take, but ultimately it's out there and available, and we have a responsibility to help people know how it can benefit them, as well as advantages, disadvantages, cost factors, and be that unbiased source. So I think from that standpoint that's where extension comes into play. It's not to say that because there's naysayers out there that we shouldn't do this. What it is saying is that we need to do it because there's people who need the information, and education's the business that we're in. And we need to be politically astute as we do it. We need to promote the educational component of it. And so as people think about, and extension educators think about their role and what they're planning for, are they an advocate and doing advocacy, or are they doing education? And they need to, having that pulse in their community, they need to know what works in their community, what's going to benefit the people the most, versus promotion of necessarily a program, but more so how it can help people is a key. And then we also need to be responsive to needs and be flexible. And this is a topic now that has the potential to affect every family in every county in the state of Wisconsin, and it's going to affect across the whole nation. And it's the teachable moment for the teachable topic of the moment. And so thinking about that, extension really needs to be at the table. They can't, I guess I think that if we aren't at the table, then we need to wonder what is more important than this at this point in time. And it's key. 2013 is going to be what we call that teachable year. So people need to do that. And normally what happens in extension, our programs are based on needs, and this is a need that's there now.
Okay. Does the programming around the Affordable Care Act, is that only relevant for you and me and family living, or is it relevant for our colleagues as well?
I guess I would say that overall, I think it impacts all of the program areas within UW-Extension, all 4 program areas. And I'm in family living education. You've mentioned some of that, but I'm going to start out with the community natural resource and economic development area. Sometimes they're referred to as resource agents or community development agents. They work with businesses and local government entities as well as other things, but those are some key areas that they work with. Well, we have businesses out there wondering, what does this mean? How is it going to affect me? What is it I have to do? What choices do I have? Where can I go for information on this? That local resource agent has a direct tie or a direct link there and can provide that information. In the area of agriculture and agribusiness, and I mentioned earlier, I've already received calls from farm businesses and farm families about what this means. But also think about agriculture right now is currently has one of the highest injury, or is rated as the highest injury-related occupation that's out there. Well, from that standpoint, what can access to medical care insurance mean for those families, farm businesses? So it fits there as well. In the 4-H and youth development area, well, this is an excellent opportunity. There may be people here that need to make choices, or it's the first time they're going to have insurance, but we have a direct link to a specific group there. But we also have youth development agents that are reaching out to at-risk families. And so in their youth are involved, and oftentimes their parents are involved, helping as leaders in those efforts. So a natural tie to reach a segment of the population that maybe people hadn't thought could benefit from this. And then, of course, there's the family living area that financial literacy. We have a financial literacy work team within UW-Extension. We have a families and community team. Those are direct links. And then you look at our health insurance literacy group, which is a direct part of health literacy. That's another key where joint programming can also build on that whole systemic type of a systems approach to helping people create health. And if you look at the Affordable Care Act, that's what I see is that the objective there is to create health for individuals as well as communities.
Okay, I'm going to go back to some slides. I apologize for some things having gotten out of order here. I'm going to quickly go through some resources that we have available just so that we understand that they're going to be out there. This is our new, we're temporarily calling it a toolbox on the Affordable Care Act, which will be on our CKF site. We have some fact sheets that this is our first one we've just put together on the Affordable Care Act. Those will be posted there. I have an ongoing health reform blog, which is on Extension's website, and I had just posted something the other day on Governor Walker choosing a federal exchange for Wisconsin. There are other resources that I want to know that are available. Health Reform Hits Main Street is a video, and it's a great video. There's an easy-to-use summary on the Kaiser Family Foundation. Robert Wood Johnson has a lot of information that's out there. I find them a very useful website. And of course, there's the healthcare.gov site where you can get consumer assistance supposedly related to your state. There's a whole lot of information on prevention and wellness. There's everything on there about the healthcare law and you. And one of my favorites is on the Kaiser site on the implementation timeline. And if you were to click on each of these, it would tell you what's been in place and what they all mean. And this is a map from that site as well from Kaiser about the mapping the effects of health insurance coverage expansions. So I think we covered this particular aspect here. You mentioned that this is a lot about community health building, community capacity through partnerships and collaborations and comprehensive systems approach. Are there any other things that you'd like to leave us with, Mary? Thoughts that you want to share about what Extension could be doing?
Well, as you put it all together and we talk about that aspect of community capacity and partnerships and collaborations, that's what Extension is known for in communities, and that's, as I look at this and putting it all together for those people who either have never had or need to look at what insurance options are available to them, that taking a look at that whole total package, it's whether it's through their work, through the things that they do in the community, individually, Extension's a natural tie there that can help them to learn this. And this webinar today is an excellent example of Extension's responsiveness to an emerging issue that's out there, and in partnership both with children, covering kids and families, and then also the Wisconsin Council on Children and Families, and I think it's Enroll Families.
Enroll America.
Enroll America. Ultimately, when you put all three of those together along with Extension, it's an excellent example of the kinds of things that can be done to share information, to help people become educated, who in turn then have the opportunity to take it out to many more people than we could address on a one-on-one basis or as individuals in our communities.
Well, probably in the interest of time, why don't you tell us what you think this all means in summary?
Well, the Affordable Care Act, as I see it, goes beyond health insurance, trying to help us build or create health for individuals and community. And when we look at all the components that are there and what we need to make happen, it's the first time in America that at least I'm aware of that healthcare is a priority for the nation as a whole. And it's the opportunity for community educators, and particularly Extension, to work with their local partners on public issue education around the Affordable Care Act. And It's education that can help the consumers, the community leaders, the business owners understand what's needed, why it's there, what it's going to cost, how it affects them, how it will affect their employees and the community as a whole. It's the opportunity to do that direct consumer education and increase overall health literacy. And then Extension as that neutral, unbiased educational resource can work together, pull together the partnerships and coalitions for collaborative efforts within their communities and help them create health for individuals, for families, for businesses, the community as a whole, and as our part of this nationwide effort.
Okay, thank you. Well, Danielle, we'll throw it back to you for questions that you've been collating for us.
Sounds good. Thanks for everyone for sticking around. We just have a few more minutes to kind of wrap things up. So I'm just going to take a few questions from our audience members. Just one that came up quite a bit. Our PowerPoint slides will be available online on our website, www.ckfwi.org. So those will be archived there as well as this webinar presentation. And Jenny, if you're still on the line, this might be a question for you specifically. There were a number of questions about kind of what the exchange is going to look like. And this particular person wanted to know, for people that are new to buying insurance, how often are these people going to have to enroll and provide documentation and proof of documentation as they enroll in the exchanges? Like, do you know if it'll be an annual thing or if it'll be biannually, or any details on that?
Sure, that's a great question. So there's sort of two answers to that. If somebody is enrolled in a plan through the exchange, then that coverage is technically effective for 1 year. So they'll get in this coming fall, into the fall of 2013, and that open enrollment period, by the way, runs, the first time it's a bit longer, at 6 months. So they have between October 1 of next year and March 31st of 2014 to get enrolled. And that coverage covers them for the 2014 year. They will have the opportunity to change plans or update, they'll be able to change plans then the following fall. There'll be an open enrollment period every fall, and it's going to be the same open enrollment period as exists for Medicare from mid-October to early December. But if somebody's circumstances change during the year, let's say they lose their job, we need to be doing a good job of educating consumers about the fact that changes in circumstances might mean that they're eligible to get more help to pay for their coverage. They may become Medicaid eligible, or in the opposite direction, they may want to let the exchange know if their income goes up, because they might not want to take so much of that premium tax credit as they were getting in the earlier part of the year, because this is a whole can of worms that we didn't get into today, but individuals, if they take more assistance, then it ends up looking like they were eligible for due to those changes in income, they're going to have to pay some of that back the following year. So the quick answer is people are eligible for a year. The more complicated answer is they need to keep an eye on their situations and make sure they're updating as their situation changes.
Okay, thank you so much.
And the one other thing, sorry, just to clarify so folks have the right impression, eligibility is always open, as it is today, for Medicaid and Badger Care, and that won't change.
Okay, great. As we're about to close here, I think as we've heard today, there are a number of questions. Obviously, our audience is comprised of a number of different representatives from different agencies. So we're going to be taking all of your questions and posting them on our blog and our websites to address the complexity of them. Some of them aren't able to be answered right away, and some of them require more time than we have. So with that, I'm going to go ahead and close. Just remember that this is archived at www.ckfwi.org. There will also be a short evaluation survey sent to all of those that registered, just to so we can gain your insights and your feedback as to how this webcast went, and also to provide your insight into what other questions that you would like to have answered. So with that, we'll just look forward to receiving your feedback. Feel free to email or call us at any time, and thank you so much for joining us.